Irritable bowel syndrome. Irritable bowel syndrome is a group of symptoms that affect your digestive system. It's a common but uncomfortable gastrointestinal disease, or a condition that affects your intestines. People with IBS experience symptoms that include abdominal pain and cramps. With IBS, you may also have frequent diarrhea, constipation, or both. IBS doesn't cause tissue damage in your gastrointestinal tract or increase your risk of more serious conditions, like colon cancer. Instead, it's a chronic condition that most people can manage by changing their routines and what they eat, taking medications, and receiving behavioral therapy. What are the types of IBS? Researchers categorize IBS based on how your stools or poop look on the days when you're having symptom flare-ups. Most people with IBS have normal bowel movements on some days and abnormal ones on others. The abnormal days define the kind of IBS you have. 1. IBS with constipation. Most of your poop is hard and lumpy. 2. IBS with diarrhea. Most of your poop is loose and watery. 3. IBS with mixed bowel habits. You have both hard and lumpy bowel movements and loose and watery movements. Certain treatments only work for specific types of IBS. How common is IBS? It's very common. Experts estimate that about 10% to 15% of adults in the United States have IBS. Only about 5% to 7% see a provider and receive a diagnosis. It's the most common disease that gastroenterologists diagnose. What are the symptoms of IBS? Signs and symptoms of IBS include 1. Abdominal pain or cramps, usually related to the urge to poop. 2. Excess gas and bloating. 3. Diarrhea, constipation, or alternating between the two, for mucus in your poop. 5. Feeling like you're unable to empty your bowels after pooping. What causes IBS? Researchers don't know exactly what causes IBS, but they classify it as a neurogastrointestinal disorder. These conditions, also called disorders of the gut-brain interaction, have to do with problems with how your gut and brain coordinate to help your digestive system work. Communication challenges between your brain and gut can cause 1. Dysmotility. You may have problems with how your GI muscles contract and move food through your GI tract. The large intestine muscle tends to contract more in people with IBS. These contractions cause cramps and pain. To visceral hypersensitivity, you may have extra sensitive nerves in your GI tract. People with IBS tend to have a lower pain tolerance than people without it. Your digestive tract may be super sensitive to abdominal pain or discomfort. Other potential causes of IBS include 1. Gut bacteria. Research has shown that people with IBS may have altered bacteria in their GI tract, contributing to symptoms. Studies have shown that the types and amounts of gut bacteria are different in people with IBS than in people without it. 2. Severe infections. Some people get diagnosed with IBS after a severe infection affecting their GI tract, suggesting germs may play a role. 3. Food intolerance. Sensitivities or allergies to certain foods may contribute to IBS. For childhood stress, IBS is more common in people who experience severe stressors in childhood, including physical, sexual, and emotional abuse. Lab tests. Most lab tests exclude other conditions that may be causing your symptoms, like an infection, food intolerance, or a different digestive condition, like inflammatory bowel disease. Not everyone needs the same tests. 1. Blood test. To check for a digestive disease condition or another condition that may cause your symptoms. 2. Stool test. to check for an infection or signs of inflammation in your bowel caused by a digestive condition. 3. Hydrogen breath test, to see if you have an overgrowth of bacteria in your gut SIBO or a food intolerance. Imaging tests. You may need imaging procedures to rule out conditions involving inflammation or abnormal growths in your GI tract. 1. Colonoscopy can help your provider determine if you have certain bowel disorders that may be causing your symptoms, including polyps, IBD, and cancerous growths. For this procedure, a provider inserts a scope that allows them to view your entire colon. It's a flexible sigmoidoscopy, similar to a colonoscopy, except a provider inserts a scope that allows them to view the lining of your rectum and the lower part of your colon only. 3. Upper endoscopy can help your provider diagnose celiac disease or other GI conditions. This procedure uses a scope that allows your provider to see inside your esophagus, stomach, and the first part of your small intestine. No specific therapy works for everyone, but most people with IBS can find a treatment plan that works for them. Typical treatment options include changing the foods you eat in your routine. Medications can help too. Behavioral health therapy may help. Many of these treatments take time to work. It can help your symptoms, but your symptoms may not go away completely. Meal changes. A dietitian can help you choose foods and modify eating, drinking habits to avoid symptom flare-ups. They may recommend that you 1. Increase fiber in your diet. Fiber-rich foods, including fruits, vegetables, grains, prunes, and nuts, can help if you're struggling with constipation. Introduce fiber slowly into your diet to give your gut time to adjust. 2. Add supplemental fiber to your diet. Another option is to try fiber supplements like Metamucil or Citracel. 3. Limit dairy products like cheese and milk. Lactose intolerance is more common in people with IBS. If you cut back on dairy, make sure to eat non-dairy foods rich in calcium, like broccoli, spinach, or salmon. Limit foods that can make you gassy. Foods like beans, Brussels sprouts, and cabbage are notorious for causing gas, but carbonated sodas and even chewing gum can make you gassy. Reduce these foods to go easier on your gut. 5. Avoid gluten. People with IBS, even those without celiac disease, tend to be more sensitive to gluten. If you opt for a gluten-free diet, work with your provider to ensure you're getting enough of the key vitamins and minerals often found in foods with gluten. 6. Try the low FODMAP diet. This food plan reduces the amount of hard-to-digest carbohydrates you eat. It recommends alternatives that allow you to get the nutrients you need while going easier on your GI tract. 7. Drink plenty of water. Drink at least 8 8-ounce glasses of water a day. Water keeps your GI tract lubricated and can help treat or prevent constipation. 8. Keep a food diary. Your provider may recommend that you note the foods you eat to determine which foods trigger IBS flare-ups, and then bring this to a nutritionist. Activity changes. Changing daily activities can help too. Your provider may recommend that you 1. Exercise regularly. Aim for 150 minutes of moderate exercise weekly. This is about 30 minutes a day, 5 days a week. Moderate means you're raising your heart rate. To try relaxation techniques, daily yoga, meditation, and other distressing techniques can help calm an overtaxed nervous system and a nervous gut. Sometimes, a behavioral therapist can help. Get enough sleep. Aim for 7 to 9 hours of quality sleep each night. Go to bed at the same time each night. A good night's rest is one of the most powerful distressors available. Reach out to a provider if you're having trouble sleeping. For keep an activity diary. Record the activities that help you manage your IBS and compare notes with your provider. Medications. Your healthcare provider may prescribe medications to provide symptom relief, including 1. Antidepressants, if you have depression and anxiety, along with significant abdominal pain. Medications include tricyclic antidepressants and selective serotonin reuptake inhibitors. 2 medications to ease constipation, including fiber supplements and laxatives. 3 medications to firm stools like antidiarrheals. 4 medications to help with intestinal spasms. 5 probiotics. These good bacteria may help relieve IBS symptoms. Is there a cure for IBS? There isn't a cure for IBS, but most people manage symptoms by avoiding triggers and taking medications when necessary. Does having IBS increase my risk of developing serious gastrointestinal problems? No, IBS doesn't put you at higher risk of developing conditions such as colitis, Crohn's disease, or colon cancer. Prevention. Since there's no known cause for IBS, you can't prevent or avoid it. If you have IBS, you can keep symptoms from flaring up by avoiding triggers. When should I see a healthcare provider? Contact your provider as soon as possible if you have common IBS symptoms alongside 1 fever, 2 vomiting, 3 rectal bleeding, 4 unexplained weight loss, 5 diarrhea so severe it wakes you up at night, 6 severe abdominal pain. Thank you.